Okay, let's move to our first question. We are gonna move now. Okay, so first trimester, guys. So I have done this trimester wise, so it will be easy to understand, easy to memorize. Okay. Okay, a nurse is providing teaching to a newly pregnant patient at 8 weeks. Which food should the nurse recommend to increase folic acid intake? If you guys can comment, please do. So, likewise, we know folic acid um, is synthetic form of folate and very important for cell division, formation of genetic material, for DNA, RNA, and lack of folic acid can cause neural tubal defect. So, if you guys can comment, will be appreciated. Okay, do we have folic acid in leafy green vegetables? Do we have folic acids? Marcy Marshall A. Yes, yes, because spinach, kale, all the green are excellent. Yeah, so A is correct. Okay, cool. Next one. Can we get it from citrus fruit? Can we get it from citrus fruits? Please do put like A yes or B yes like that, so we will know, because there will be mixture of comments. Yeah, Leslie, actually we can get it from citrus fruits like orange and grapefruits. They are rich in folic acid, so we can actually get it from citrus fruit. Okay, yeah, and whole grains is green. Yes, Marcy. B is yes. B yes. Is C correct? Whole grains. Yeah. Yeah. So guys, C is yes also. Okay. C is yes also. Yes. So C is yes also. Especially it's mandatory. It's mandatory. 40 government, many governments has mandate it for like grain products to be fortified with folic acid, because it does help to prevent D red meat. Um, Actually, that's controversial. Clash One Royal, that's controversial. Because in D we usually see iron more and B12, but it doesn't have enough folic acid. This is very controversial with red meat. Yes, D is actually no. Okay, red meat is higher in B12 and iron, but it doesn't have enough folic acid. Okay, what about dairy products? Does dairy products help with folic acid? E, anyone? E, no. Yes, so dairy products is primary source of calcium and vitamin D, but we don't see much folic acid in E. Okay, so from these options, only leafy green vegetables, citrus fruit, and whole grain is gonna help pregnant patient at 8 weeks. All good. Let's move to next question. Okay, a patient at 10 weeks reports nausea and vomiting. Which intervention are appropriate? Question number B, nausea and vomiting. And if you guys know, especially around 10 week, most of the pregnant women, they experience morning sickness. uh, Around 70% of patient does experience morning sickness, and everyone is aware about why we have morning sickness, because there is surge in pregnancy, there is surge in pregnancy hormones, particular human chronic. Yes, D, yes, because sometime vomiting can be very severe. Vomiting can be very severe and it can lead to dehydration and weight loss. And we have specific name for that condition. Yes, we have specific name for that condition, hyperemesis gravidum. Okay, so that's why in that scenario, to prevent that, we need to avoid that. Alrighty, is E correct? Drink coffee every morning. Drink coffee every morning. No, yes, yes, definitely. Because caffeine is gastric irritant. Caffeine is gastric irritant, so it's not recommended. And especially when it's written every morning, it can't be. It should be limited amount. Okay. So we're gonna cross over question number 2. Okay, let's move to question number 3. So, a patient at 12 weeks asked about safe exercise during pregnancy. Which should nurse recommended? So 12 week. What is the rationale? Because in during 12 week we can ask patient for regular exercise, moderate exercise only, because it's beneficial. Yeah, and especially if patient is having no uncomplicated pregnancy, it is safe. So walking, is walking good? A yes, definitely a yes. Walking good, and because it's very low impact and accessible, patient can do that exercise anytime. So definitely walking is good. B, yes, Marcy. Yes, yeah. And swimming is really really beneficial for pregnant women, because it can provide the full body workout. Yeah, and it reduce the strain on weight bearing joints especially. So B is definitely yes, a big yes. Yes, it does help them a lot. Yeah, what about C, guys? Contact sport. Is contact sport safe during pregnancy or not? Is contact sports safe during pregnancy or not? C, no. Yes. Yeah, such as contact sports like soccer, basketball, or anything like martial art. um, Patient have higher risk of fall and direct abdominal trauma, so we really don't want to do that. Okay, because it can cause placental abruption. Yeah, so we don't want to do that. We don't want to do that. Is prenatal yoga helpful? The yes, definitely. That's the good one. Yeah, because it is gentle stretching, it's not too much stressing. it is gentle stretching, so we can recommend prenatal yoga. And we do have classes also for prenatal yogas, like where patient can join together and share their concerns. So D is definitely good one. And heavy weight lifting, yes, because what's gonna happen, it's gonna put unnecessary strain on pelvic floor. Yeah, and especially at back. We need lighter resistant trainings, not heavy weight lifting. Yeah, great work, guys. Great work. Let's move to question number 4. So, a nurse is reviewing routine prenatal lab. Which result require follow up? So, this is we are talking about first trimester things. Okay, positive HIV test. Does it require follow up? What about A, guys? B, yes. Yeah. A also yes, because they need antiretroviral therapy, because we really don't want that HIV to transmit from mother to baby. Okay, so this is definitely gonna require follow up. Yeah. Rubella, positive rubella, B1. Yeah. So if patient is having positive rubella IgG, what it is indicating is B, yes. What it is indicating, guys? Please make sure we are watching for result that require follow up. Does it indicate that patient have immunity, or does it indicate patient have rubella disease? Because we only having immunoglobulins. What about B, guys? So if we are having positive rubella immunoglobulin, that means it's immunity. That means patient is immune to rubella. Okay. So this is a good finding. B is good finding. So we don't need to follow up for B. Righty. So actually B is no. Okay. When we have antibodies, that mean body is immune. Hemoglobin C. C, yes, for me? Yes, definitely C is yes, because it is indicating 90 gram per liter. Yes, Marcy. Yeah, it's indicating patient is anemic actually. Okay, patient is anemic, so that's why we need C. We need C. Okay, we need to find out the cause. We need to start the iron supplementation. So C is definitely yes. D, positive hepatitis B surface antigen. What about D, guys? Hi. Positive hepatitis B surface antigen. What about D, guys? Okay, this was the difference. This was the difference when we were talking about immunoglobulin, because that was antibody and this is antigen. D is antigen. Okay. Yeah. So D is antigen, so it indicate there is a infection, there is a acute infection. Okay, so we need to follow up for this one. Okay, when you have antibodies, that's immunity. When you have antigen, that's the active disease. Okay, it's gonna require hepatitis B immunoglobulin, HBIG. Yes, definitely we need follow up for D. Okay, negative syphilis serology. What about E, guys? Yeah, is E good indication? E is a good indication. Okay, for me, B is no. B is actually positive rubella immunoglobulin. Okay, so we don't need to worry about that. That is antibodies that will be present in anyone who have vaccination. That is the good indication. Okay, so we don't need to worry about positive rubella IgG. We just need to worry about antigen here. Okay, let's move to question number 5. Okay, guys, question number 5. The nurse is teaching a patient about warning sign during pregnancy that require immediate medical attention, which should be included. Thank you, Chair. Which should be included because we need it is very crucial for pregnant patient, to recognize signs of potential complications. So we need to be aware about indicators of life threatening situation because that can be life threatening for mother also and fetus also. Okay, so we need to, is vaginal bleeding is concern, is a concern if patient having vaginal bleeding, and what it can indicate. What it can indicate, guys. If patient is having vaginal bleeding, what it can indicate. Hemorrhage, yes, Kamil, hemorrhage, because it can be sign of miscarriage, it can be sign of ectopic pregnancy, it can be sign of placental abruption. Yeah, so A is definitely yes. Do we need to worry about severe abdominal pain? Yeah. Do we need to worry about severe abdominal pain? Because what is the indication of severe abdominal pain in pregnancy? It can be due to ectopic pregnancy. It can be due to placental abruption. Yeah, yeah. So we gonna watch for severe abdominal pain also. Yeah. When patient have swelling of face and just abrupto placenta, definitely. When patient have swelling of face and hand, especially during the pregnancy, because we know about why we have high blood pressure during pregnancy. Eclampsia, yes. Increase of water, yeah, yeah. Especially preeclampsia because pregnancy woman is very prone to preeclampsia. Yes, water retention, yes, definitely Kamel. So that's why, okay, that's why we have swelling of face and hand. Increased fetal movement. Do we need to worry about? What about D, guys? Do we need to worry about? C is actually, for me, C is actually correct. Okay, we see swelling of face and hand during preeclampsia, and we need to watch for higher blood pressure. What about D, guys? What about D? Increased fetal movement. Is it a good indication or is it a bad indication? D, no. Yes. Okay, it's incorrect because this is a positive sign. Thank you, Marcy. Because it mean like baby is healthy, fetus is healthy, well oxygenated. Okay, if there is a decrease, if there is a decrease in fetal movement like fewer than 10 in 2 hours, that is a warning sign. Okay, not the increased fetal movement. And what about severe headache? Do we need to worry about severe headache? Yes, Marcy, baby is active, baby is very active. Do we need to worry about severe headache? Yes, yes, it is because sometime like we need to always just check hypertension. Preeclampsia is a big one in pregnancy, so we need to do that. Okay, and when patient has severe persistent headache, um, it is symptom of preeclampsia, so we need to manage that one. Well done. Let's move to next one. Okay. Question number 6. A nurse is caring for a 20-week pregnant patient. Yes, risk of seizure definitely in that one. A nurse is caring for a 20-week pregnant patient. Which finding are normal? Quickening, fundus atomblicus, fetal rate, heart rate is 140, blood pressure 160 by 100, or fundal height 20 centimeter. Is quickening normal during second trimester? A yes, yes, definitely a yes. And especially mother typically feel quickening between 16 to 20 weeks. So that's why A is correct. Okay. B yes, fundus atomblicus, definitely for me. B is correct also because fundus height, the distance of the from the pubic bone to top of uterus, it is good indicator, it is good indicator of gestational age. And at 20 weeks anyway, it is expected to have fundus at umbilicus, so we're gonna be correct with B. Fetal heart rate 140 beat per minute, is that okay? What is normal fetal heart rate? What is normal fetal heart rate, guys? 110 to 160? Yes? Yeah. Yeah. 110 to 160 is normal. So that heart rate is falling between the normal range. Okay? Usually we manage 110 to 160. Okay? So C is correct. C is correct, guys. Marcy, that margin will be very less, 150 to 160. Okay, that margin will be very less. Yes, it's 110 to 160. Yes, it is, Carmel. It is 110 to 160. Okay, yeah. What about the blood pressure? What about the blood pressure, guys? D, yes. These are actually not normal. It is signs of preeclampsia. Likewise, we already talked, because blood pressure of 160 by 100 is, yes, D is no, is a lot. It's a lot, guys. It's too high. So these are not normal. Okay. Fundal height 20 centimeter. What about E, preeclampsia? Yes, Marcy. Definitely preeclampsia. What about fundal height? So the good rule about fundal height is it goes like centimeter to week. So at 20 week we can expect 20 centimeter. Okay, so that's actually normal. Alrighty, yeah. So in second and third trimester, what happen? The fundal height in centimeter should correspond to the week of gestation. Okay, so if it is 15 week, it will be 15 centimeter. If it is 20 week, it will be 20 centimeter. So it is normal finding. Okay, so that's good one. Okay, they have to match. Yes, Cap. Question number 7. A patient at 22 weeks is undergoing an ultrasound. Which finding would be expected at this stage? Okay, fetal heartbeat visible, sex of baby identified, fetal movements felt by mother, fetal lungs fully mature, or amniotic fluid present. What about A, guys? Is fetal heartbeat visible at 22 week? Definitely. Everyone happy with A? Yes, everyone happy with A, definitely. Because heartbeat is visible especially very earlier during pregnancy, around 6 to 7 week. Okay, after 6 to 7 week we can start hearing fetal heartbeat. So certainly if pregnancy is at 22 weeks, we can expect A. Okay, sex of baby identified, is it correct? His genitalia will be formed by week 22. Yeah, yes. So definitely by week 22, the external genitalia are typically well formed. Okay, and that can give us determination whether baby is boy or girl. Okay, depend upon which position baby is placed. Okay, fetal movement felt by mother. Is it correct? We just talked about fetal movements before. So what we call fetal movement? Quickening. Yeah. See, yes, Marcy, definitely. We're gonna have fetal movement over there. Yeah. So quickening will be present. Okay. Fetal lungs fully mature. Fetal lung fully mature. Around how many weeks fetal lungs will be matured? Is it 22? D no? Yes. D no. Definitely D is no. How many weeks it need? Anyone? So D is definitely no. So fetal lung to premature labor, yeah. So fetal lungs at least need 36 week, guys. Marcy, it need 36 week to have enough surfactant. Okay, so if premature baby born at 22 weeks, okay, they will have very immature lung. They can have respiratory distress syndrome. So D is no. Okay. And what about, guys, what about amniotic fluid? Is it expected finding or no? Yeah, yeah. Now all good, all good. Yeah. Is amniotic fluid will be present? Expected finding. Yes, yes, because it is present throughout the pregnancy. Yeah. We just need to measure the range during ultrasound just to make sure it is within a healthy range. So that's why this is normal finding. Okay. Let's move to question number 8. So a patient at 24 weeks is being educated about gestational diabetes risk, which are risk factor. So it's about gestational diabetes, so we can check everything. We can make sure, because like gestational diabetes is gonna create carbohydrate intolerance, and it usually start during the pregnancy, and especially because pregnancy hormone create insulin resistant. Okay. So what about obesity? Obesity is gonna cause, yes, a definitely, yeah, because when we have excessive adipose tissue, they increase the insulin resistant. They increase the insulin resistance, and that is one of the cause of development of gestational diabetes. Okay. Family history of diabetes, is it important? If patient already having family history of diabetes, is it gonna, yes, B is yes actually, yeah, because it is very very important, and they can make them prone to have diabetes during pregnancy. What about maternal age? Does it affect the development of gestational diabetes or not? It does. Yes. Def- Charity, actually it does. So the risk of gestational diabetes increase with age. Okay. And that usually happen because as we age, pancreatic beta cells activities and function decline. So C is definitely yes. C is definitely yes. Okay. That's the another factor that affect history of macrosomic infant. If patient is having had a previous birth of a large baby, over 4,000 gram or 9 pound, that indicate actually macrosomic infant. So is it gonna affect gestational diabetes in patient? Yeah. Everyone happy with D or not? So D is actually correct, guys. D is also correct, because that is very good. Yes, that is very good indicator of um, gestational diabetes. Yeah, Kamal, definitely it is very good indicator, strong indicator. Okay, so D is correct. Can smoking increase diabetes? Can smoking increase diabetes? Yes, D. Yes. What about E, guys? Does smoking have any relationship with diabetes? E, yes. Masi, actually, no. It does not. It does not cause diabetes, even though it does have another, negative effect on the health. But there is no link between smoking and development of diabetes. Okay, it's not a direct risk. It's not a direct risk. Okay, let's move to question number 9. So a nurse teach a patient about iron supplementation. Which instruction should be included? Masi, actually, it doesn't have any direct, indication with diabetes. Yeah, it can cause another respiratory cardiovascular, but not diabetes. Okay. Yeah, sweet. The nurse teach a patient about iron supplementation. Which instruction should be included? Do we need to take iron supplementation with vitamin C? Example, orange juice or any other? A, yes. Yes, definitely, because vitamin C increase the absorption of iron supplements. So we need vitamin C in body. Do we need to take it with milk? What about B, guys? A, definitely, yes. A, C, D, E. Yes, dynamic. These are correct. Yes. So B is no, because it can affect the absorption of iron supplements. So B is no. B is big no. Can we expect dark stool after patient having iron supplementation? Yeah. Yeah. No orange juice. Yes. So definitely, because it can cause stool to turn dark or black. Um, but it is normal. It is normal finding. And take on empty stomach if tolerated. Is iron absorption best to take on empty stomach? Yes, see, gesture, because it will increase the absorption. It will increase the absorption when iron supplementation is taken on empty stomach, and that's why they usually take in the morning. Okay, yeah. Avoid taking with antacid, and we have learned about antacid in our last few lives. So what antacid can go with the absorption? Whether they're gonna increase the absorption or decrease the absorption. Is antacid gonna increase the absorption or decrease the absorptions? Yes, yes, Charity, we're definitely gonna avoid it. Marcy, we're gonna avoid taking with antacid. Okay, yes, because what's E gonna do? We know antacid decrease the absorption of medication, especially magnesium, calcium, and aluminum one. Okay. Okay, let's move to question number 10. So, a nurse is assessing a pregnant patient for domestic violence. Which sign may indicate abuse? Okay, let's find out. that one, because pregnancy can be a time of increased risk. It can be risk of domestic violence, so we need to be very vigilant about signs of abuse. If a patient not feel safe, or even if they can't disclose it directly, you need to ask patient in private, space. Delay in seeking prenatal care? Yes. Charity, definitely. ABDE. ABDE, let's find out. Okay, delay in seeking prenatal care, because they can control, the other person can control the mother not to seek the care, okay, not to seek the help. So just putting them in isolation, just putting them in kind of control, so definitely that is a good indicator of abuse. Okay, partner always answering question, is B correct? Not letting mother to answer the question. B, yes, yes, definitely. Because again, like we discussed in option A, partner can control the situation and narratives. Okay, so they are not allowing patients to speak freely or privately. So that's why we have B as correct. Okay, expected. Yes. Okay, multiple bruise in various stages of healing. Yeah, what can be that? It can be in different colors. It can be in different colors. Yes, Marcy, especially yellow, green, purple. Can indicate multiple injury at different time. So that is actually a good indicator. So we need to be aware about C. Consistent attendance at appointment. What about D, guys? Is it normal or not? Or is it good thing? If patient is attending all the appointment consistently, is it a good indicator? D, no. Yes, D is actually no, because they are attending it. Okay, this is normal behavior. This is positive behavior. That's what we want. That's what we want. Okay, so patient does have tendency to come and talk to us. Alrighty, patient appear anxious or fearful. Can we see on the face of patient if they are feeling or if they are going through domestic violence? Yes, definitely, because fearfulness, withdrawal, unusual level of anxiety, anxious while giving the answers, especially in presence of partner, it is a good indicator of domestic violence. Good one, guys. We will do 5 more question on this one, and then we will end our session on YouTube, and I will really tell you when we're gonna be live on TikTok again. Okay, let's do third trimester question. Okay, a patient is at 32 week, has vaginal bleeding with no pain. Which nursing interventions are appropriate? So we are right now on 32 weeks. Okay, what can be the indication of if somebody is having vaginal bleeding? What can be indication of placenta previa? Yeah, so placenta previa, it is the classical sign, especially at 32 weeks, because it can be partial, it can be complete. Okay, and incomplete, it can cover the cervical opening. So we need to be very aware about that one and seek medical help. Place on bed rest? Yes, definitely A, guys. Definitely A is correct answer. Yeah, yeah, because placing on bed rest can reduce the uterine activity and pressure on the cervix. It can help to prevent further bleeding. Okay. Next one, prepare for cesarean delivery. Do we need to prepare for cesarean delivery right now? What about B, guys? B, yes. Actually, actually, we don't need to. Okay, we don't need to. Yes, dynamic, definitely. We don't need to. Even though maybe placenta previa requires cesarean delivery, but this is not the first step, and we are not gonna prepare for cesarean delivery yet. There are highly chances we can prevent it. Okay, so priority right now is to stabilize the patient and fetus. Okay, so definitely B is no. C, perform vaginal exam. Do we need to do that? Is it a indication or not indication? C, no. Yes, C is no. Big no. It is strict contraindication. Okay, because it can puncture the placenta and cause a like life-threatening hemorrhage. Okay, so we are not gonna do the C. Okay, we are not gonna, yeah. Monitor fetal heart rate. Do we need to monitor fetal heart rate? Yeah. Yes, monitor always, because it's crucial. So we wanna make sure whether if there is a bleeding going on, fetus is getting enough oxygen supply. Because if fetus is not getting enough oxygen supply, it's gonna lead to distress, and then we will have higher fetal heart rate. So it's always important to monitor. Do we need to obtain ultrasound? Is ultrasound gonna confirm anything with us? Yes, yes, guys, definitely yes, yes, Marcy, because it is definitely diagnostic tool that can help us to locate the placenta's position, and to understand why bleeding is happening. We need to know where is placenta. So that's why on that time obtaining ultrasound is very important. Okay, so A, D, and E is correct. Just charity, because otherwise there is no other way we can find out. And at 32 weeks, it's important to find out where is placenta, and especially if somebody is having partial or complete obstruction, this is the only thing that's gonna tell us. Okay, cause bleeding is an indicator, but not always gonna tell us what's happening inside. Okay, next one. A nurse suspect placental abruption in 34-week patient. Which findings support this? We need to find out that now. A severe abdominal pain, dark red vaginal bleeding, rigid abdomen, painless bleeding, or uterine tenderness. Question number 12. We only have 3 left after this one for this session, and you guys are really doing good. Okay, severe abdominal pain. So key indication here is placental abruption, and in 34-week patient. Okay, can we see A? Yes. Yes, Marcy, definitely we gonna have severe abdominal pain in patient. Okay, because bleeding is accumulating inside, we have placental absorption abruption over there, and now bleeding is accumulating between placenta and abdominal uterine wall. Okay, That's why there are more contraction. That's why there is more irritation on uterine muscle. That's why there is more pain. Okay, dark red vaginal bleeding is B. Yes. Yeah. B. Yes, definitely. Because in placental abruptions, sometime there will be time for clot to make. Okay, and it is in placenta previa we are gonna have bright red. In placenta abrupta we're gonna have dark red. Okay, so that's why B is correct. And what about C, guys? Rigid abdomen. Why we can have rigidity? Why we can have rigidity in abdomen? Yes, C is definitely yes again. Because again, like why we talk about severe abdominal pain, accumulation of blood in uterine and continuous uterine contraction gonna cause abdomen to feel hard and board like. Okay, that's the indication, board like abdomen. It will be very rigid. Will patient have painless bleeding or painful bleeding? D. No. Yes, definitely. Painless bleeding is key indicator of placenta previa. Yeah, painless bleeding is indicator of placenta previa, not placental abruption. And when we talk about severe abdominal pain, so that's why these options are contraindicating each other. Okay, so we're gonna have painless bleeding. No. Okay, uterine tenderness. Will uterus will be tender, especially on palpitation? Yes, yes, Marcy, definitely is yes. Because again, like we talked, there is so much contraction going on, so uterus will be very tender to touch. Good on you guys. We are going good. Question number 13. So, a patient with preeclampsia now is admitted. Which sign confirms severe preeclampsia? So, preeclampsia is hypertension, definitely severe hypertension. Okay, and we do have specific sign. Yeah, it can cause damage to other organs also because of severe hypertension. So, is yes, is definitely yes, guys, because high blood pressure 170 by 110 is a key indicator. Anything above 160 110 is preeclampsia. Okay, especially higher on two occasion or at least even 4 hour apart, definitely gonna be indicator of preeclampsia. Proteinuria. Is proteinuria 3 plus common? What about B, guys? B, yes, yes, because higher blood pressure gonna cause damage to the kidney also. Okay, and that's why we have significant protein loss. Okay, see you. We have significant protein loss. Okay, so we are definitely gonna see B also. Platelet. What will be the range? What is normal range of platelet? Is C correct? Not correct? Or is it normal? 3K to 400K? Yeah, 2.5, 250K to 450K. Or is it 150? It is 150K to 450K. Yeah, it is 150K to 450K. So, Marcy, this is normal. Yeah, thank you, Charity. Yes. So it is 150 to 450K is normal. So this is, we don't need to worry about platelet. Okay. Yeah. Headache and visual disturbance. Headache and visual disturbance. Can we see that one? D, yes, definitely D, yes. Because what we're going to have in preeclampsia is now it's affecting the brain, cerebral edema, and vasospasm. Okay, cerebral edema and vasospasm. Charity C is, we don't need to worry about platelet. Okay, because we, which sign confirms severe preeclampsia? Yes, yes. D is definitely yes. Okay, what about E, guys? And then we're gonna have two more question. Hyperreflexia. Do we have E? Actually E is yes also, because now during preeclampsia what's happening, when impending eclampsia happen, it can overactive the nervous system. Okay, and that's why we see deep tendon reflex. That's why we see deep tendon reflex in patient with preeclampsia or eclampsia, when the nervous system is overactive. Okay, so definitely we're gonna see E. Yeah, that's the one. Okay, two more question and then we are done for this session. So this video will be posted on YouTube like this, so you can actually share it with anyone and you can go back to question, you can do your rational. Okay. Okay, a nurse is teaching about warning signs of preterm labor, which should be included. Okay, now we need to teach patient about warning signs. Low back pain. Is low back pain common warning sign of preterm labor? Yes, definitely yes, definitely yes. Okay, and most of the time it is most overlooked symptom. Okay, if patient is having persistent dull ache or rhythmic cramping also, definitely it is warning sign of preterm labor. Okay, next one, pelvic pressure. The feeling of baby pushing down. Yes, yes, because when mother will feel like the baby is kind of pushing down, and heaviness in pelvic area, increased pelvic pressure, it is sign of preterm labor. Okay, so B is correct. What about C, guys? Regular uterine contraction. What about C? Is C gonna be yes? See, yes, Marcy, definitely. So regular rhythmic contraction that increase the frequency, like duration and intensity. And when it's definitely irregular, then we know like it's gonna proceed with preterm labor. Okay. And what about sudden gush of fluid? Why sudden gush of fluid happen? D, yes, yes. Why we have sudden gush? Because premature rupture of membrane. That means there is a membrane rupture right now over there. So we will have that one. Is fetal movement normal or not? Is fetal movement normal or not? What about E, guys? Do we need to worry about E? E, no. Yes, it is normal. It is normal. So, and it is a good sign of fetal well being. So, only concern is if it will reduce. So, otherwise, fetal movement is normal. So, we don't need to worry about this. Okay. Let's move to our last question of our session and then we will finish this live. The nurse care for a patient receiving magnesium sulfate. Which findings indicate possible toxicity? Absent deep tendon reflex. And I think Marcy, you already talk about that one. So a yes, yes, because magnesium sulfate is central nervous system depressant. Okay, so it can depress magnesium. It can be toxic. Okay, yeah. So we need to have that one. Respiratory rate less than 12. Magnesium. What's gonna do? Be yes, definitely be yes, because it's gonna depress the respiratory center in brain and it is gonna cause respiratory depression. So a rate below 12 is always critical sign. Okay, so rate below 12 is critical sign. We need to watch this one. Urine output less than 30 ml per hour. What can this indicate? Toxicity? Yes, definitely toxicity. Because most of the time magnesium is primarily excreted by kidney. So if somebody is having urine output less than 30 ml per hour, what it is causing? That is mean we have acute injury kind of stuff because it's accumulated to toxic level. Okay, it can cause magnesium to accumulate to toxic levels. So C is yes, retaining. Yes, thank you, Charity. C is yeah, it is retaining. Blood pressure 110 by 70. Is it normal blood pressure or do we need to worry about? Yes, D is no. D is no. Definitely D is no. Okay, because this is normal. This is normal. Okay, so we don't need to worry about D. Especially if we are giving magnesium sulfate, we need to see lot of hypotension, not this one. Okay, not this one. Okay, so blood pressure is good right now. Okay, and what about decreased level of consciousness? E, yes. Everyone happy with E? Yeah, because magnesium toxicity, we know it affect brain, it affect neuromuscular function, so it's gonna cause lethargic. It's gonna cause patient lethargic, and that's why we are gonna have decreased level of consciousness also. Yeah, because it's central nervous system depressant. Okay, we usually give it to patient with severe preeclampsia, so that's why there will be decreased level of consciousness. How did you find this live, guys? How did you find this live? Was these good question? Was it helpful in this way? Yeah, I think this is the thing, like we need to go topic wise, we need to go topic wise, and these question will be here on YouTube. We will post it like this, so you guys can actually share it with your friend and family or whoever is studying nursing or practicing nursing. Yeah, no, it's good, Marcy, it's good. And like in future, if you guys need to go back to some question, you can go back easily. Okay, so this is why. Oh, Kamel, you can you press the bell icon so it will let you know. Okay, next time. Yeah. Alrighty. Okay, guys, thank you everyone. So I'm not sure whether I'm gonna be live on TikTok after this one later on or not, but I will post it on story. Okay. And I will create something like a group on Telegram or somewhere where I can just text like we are coming live, so you guys will know like we are being live right now. And if you have time, we still have 15 more question on maternal health. This is 30 question document. So we will do another 15 question. Okay. All good. Thank you everyone. Have fun. See you during next live and really appreciate. Please share YouTube channel with others and make sure you share this video with others also. Okay? Thank you. Have a good day.